As you age, people think about their wrinkles, they think about graying hair, change in their body composition, but what many women don't talk about or think about is their private area. Vaginal dryness, pain with sex, stress urinary incontinence, prolapse. This is something that does happen, and unfortunately, many doctors don't have great solutions, but at Vitality, we have everything that you need to make that vagina feel better sex, really improve stress urinary and urge incontinence, lichen sclerosis. And you know what? There's no topic here that is taboo, and there's no questions that you need to feel concerned about asking or embarrassed. We do it all, we hear it all, and we're here to help. So let's talk about what of those symptoms are as our vagina changes. And some of these changes can kind of sneak up on you. Vaginal atrophy has a new name, GSM, or genitourinary syndrome of menopause. But actually those symptoms can start before menopause. So vaginal dryness, women might complain that they're feeling dry or irritated, that they can also complain of burning. Sex can be more challenging because you've lost that lubrication, and so it may be difficult with penetration. Some women start tearing because of that. Also, as we age, the tissue becomes more lax in some scenarios, especially if you've had babies, you're overweight, you lift weights, and so then, you can get a bit of prolapse, you can get stress and urge incontinence. Sex also may lose sensitivity, partly because of laxity and the contact's not the same, or because aging and hormones that start kind of going out the window, and our sensitivity and ability to orgasm changes, our libido changes. So there's so many things that can happen down there, and many women, again, won't talk about it or identify it or appreciate that there's solutions out there. If you're suffering or having any of these issues, it's really important to see a physician or come to Vitality. We'll do an exam and give you a very thorough, in-depth review of what's going on and what are options to help you get where you would like to be and turn back that clock and make things feel better down there, improve your sex life, and prevent leaking and, embarrassment. So what are the solutions or options? So again, depending on what the issue is, so vaginal dryness, there's non-hormonal lubricants, there's using estrogen, DHEA suppositories, there's the O-shot, which is PRP in the private area, which is pretty amazing. There's MFEM, or radio frequency, that creates more collagen and elastin. There's the FemiLift, that's a CO2 laser. And there's other technologies with similar names to this, but CO2 laser also increased collagen, elastin, helps with lubrication, stress urinary incontinence. There's the Emsella chair that works on the pelvic floor and increases blood flow as well, and can help with stress and urge incontinence and ability to orgasm. And there's a few other things on the market, but really getting an exam and really assessing what the problem is. Is it the tissues? Is it dryness? Is it laxity? Is it atrophy? Is it the muscle? Is it the weak pelvic floor? So really important to get that assessment to really know, because if you do a treatment that didn't really address what your problem is, you might be paying money and not getting the benefits you want. So come to the experts and get that assessment and that personalized plan that will make you feel better and treat your specific problem. So if you're someone who's experiencing any of these issues that I talked about, then comment, ask questions, tell me you like what you've heard and I'll talk more, book an appointment, whatever that we can help you get where you need to be. And there's nothing that's taboo at Vitality MD. Feel comfortable with your body. Thanks everybody, see you next time.